In the previous video, we have studied about the features of ilium. Now let's study about the features of the pubis and the ischium. The pubis, it forms the anterior inferior part of the hip bone and it forms anterior boundary of the obturator foramina and adjoining 1/5 part of the acetabulum. The pubis, it consists of three parts: anterior, the body; the superolateral, the superior ramus; and the inferolaterally, the inferior ramus. The body, it consists of superior border called as the pubic crest. Lateral to this pubic crest, it consists of the pubic tubercle and it consists of three surfaces. The anterior surface, it is directed downward. The posterior surface called as the pelvic surface, it is directed upward and the backward. And the medial surface or the symphyseal surface, it is present medially and it articulates with the pubic part of the opposite hip bone to form the pubic symphysis. And now the superior ramus, it consists of three borders: the superior border or the pectineal line, which starts just behind the pubic tubercle and end at the iliopubic eminence. The anterior border, it starts at the pubic tubercle and end at the acetabular notch. The inferior border, it forms the margin of the obturator foramina. Now the superior ramus, it consists of three surfaces. The pectineal surface, it is present between the superior border and the anterior border. The pelvic surface, it is present between superior border and the inferior border. And the obturator surface, it is present between anterior border and the inferior border. The inferior rami of the pubis, it conjoins with the rami of the ischium to form the conjoint ischiopubic rami. Now the features of the ischium, it consists of body and the ramus. Now this ischium, it is present posterior inferior part of the hip bone. It consists of upper end and the lower end. The upper end, it forms 2/5 part of the acetabulum and the lower end, it consists of ischial tuberosity. Now the ischium, it consists of three borders: the anterior border, the posterior border and the lateral border. And three surfaces: the femoral surface, it is present between anterior border and the lateral border. The pelvic surface, it is present between anterior border and the posterior border. And the dorsal surface, it continues above with the gluteal surface. Now the ischial tuberosity, it is divided by transverse axis into upper part and the lower part. The upper part, it is again divided into superolateral and the infero-medial by the oblique ridge, and the lower part of the ischium, it is divided by the longitudinal ridge into lateral part and the